Okay, we are live.
Hello, hello.
Let's wait for some people to pop in.
All right.
So, Caryn, we can see their questions on the right side.
Mm-hmm.
Are you able to see people that are filtering in by any chance?
I am not, but I can see some pictures or
Oh,
some
cool.
questions. So I'm just gonna show. I'm just gonna press select the first question that we're gonna answer. Or I guess we can introduce ourselves first.
Yeah, let's do that.
Yeah.
I'll start.
Right.
Hi everybody. My name is Meghin Tobin. I'm a licensed marriage and family therapist at NOCD. I've been with NOCD for almost a year now, coming up on it. So it's crazy. Time flies so much. But I absolutely love what I do. I love being able to come onto these webinars here and there and get to talk to you guys and answer some questions live. And I am very grateful to be with Caryn because she's awesome and I've learned so much from her already. So it's amazing to be able to kind of pair with you. So yeah, hi everybody. That's me.
All right. Well, I'm Caryn, Caryn Gill. I've been working for NOCD for almost 2 years. So I started right before the pandemic or around January of 2020, working with people with OCD, related anxiety disorders, for a few years now. So love talking about it. So we're both happy to be here. So without further ado, let's just jump into it. Let's start with EB's question because I think it's a good one. So is it possible to do too much ERP too fast? So when I initially began ERP, I was watching 45 minutes of triggering videos a day, and I started getting nightmares with intrusive thoughts. So that sounds really difficult. It's really awful to have to deal with. I don't know. I guess I can take a stab at this.
It's you. I'll jump into it.
Yeah. I definitely think it is possible to flood yourself, which isn't all that helpful. It definitely can start to feel like counterproductive in that sense. And then often people, especially because they want to get rid of their anxiety so badly, they might purposely try to do as many exposures as or like the hardest exposures before they really give themselves a chance to experience like learning or really get response prevention under control. And so it definitely is helpful to take a gradual approach, especially if the reasoning behind going that hard that fast is just to get rid of anxiety. Obviously, sometimes life presents us with really tough exposures like level 10s right off the bat. And in that case, right, like you kind of just have to try to cope with it the best you can. And I think I would emphasize if you are going to take kind of like an exposure menu approach, a la like inhibitory learning, to really practice having willingness to experience that distress, having willingness to resist those exposures, and have a really good response prevention plan in place.
Yeah, I liked kind of what you said about the flooding because that was the first thing that came to my mind when I read this is we don't want to go from 0 to 100 if we can avoid it because we know that we don't give our brain the opportunity to have that learning experience if we are just drowning it in too much exposure from the get-go. So the gradual approach I find to be most helpful. That's why we do that slowly. But I'm also always up for people challenging themselves. So I think it is important for you to kind of ask yourself and self-reflect, just like you said, Caryn. Am I doing this because I'm feeling anxious about not getting better? And if the answer is yes, then we want to kind of dial it back. If you're feeling like, all right, I can really step up to the plate, take some extra challenges. It sounds like, though, EB, based off of your question, that might not be the case, that maybe it is a little too much. And if you're feeling that way, then take a step back and just do it a little bit more gradually.
Right. All right. Meghin, do you want to pick the next one?
I actually can't see the questions.
Oh, okay. So let's see. I will do that then. Okay. So let's hear from Sarah. I'm trying to figure out how to like move the banner so it's easier. No, we're like rolls in there. All right, so that's okay.
I'll
so
read this one if you want. That way,
go ahead.
the whole time, but we can alternate. Okay, so Sarah started my first task for ERP for false memory, and my intrusive thoughts will try and attack other memories or convince me that this is not OCD, or I'm using OCD as an excuse, and I get paranoid and very scared. So something that I hear pretty often, but Caryn, if you want to take the first leap at this one.
Sure. So, I mean, okay. So obviously that first exposure is going to be challenging because it kind of goes against everything that your OCD has convinced you that you need to do. And of course, like that fear that it's not OCD, that you actually do, that you actually did the thing that you're afraid of, or that your intrusive thoughts are real and not just intrusive thoughts. Aside from, outside of subtype, that's such a common experience that you don't have certainty over things that otherwise, 1,000 people would see the same situation and feel pretty certain enough, right? And so I don't know, like I guess like when it comes to trying to reassure yourself and trusting the ERP process, um, I always think of it like this, like you've already tried reassuring yourself, you've tried seeking that certainty and it hasn't really worked. And so to OCD, it's never going to be good enough. And so it's kind of like the harsh reality of compulsions. It's not like OCD will keep demanding and demanding you to get more and more certain. And especially for false memory, there's no such thing as going back in time. And then even then, if you magically were able to, your mind will then be like, but are you sure you saw things correctly, right? Because OCD is all about that doubt and uncertainty. And so learning to trust the ERP process, learning to sit with not knowing and being okay with that, I think is super important.
And I try to view these instances as like opportunities to practice resisting responding to those thoughts as well. So the OCD gets really tricky, tries to kind of suck you in and get you to do compulsions, even in moments when you're practicing exposure. So being able to lean into it a little bit more, we know that it's going to be comfortable. So we know that it's going to be difficult, but we also know that if we practice that consistently, we can come out on the other side of that and experience some level of relief from these symptoms. So I probably have, and Caryn, you'd probably say the same thing. I have the conversation about my OCD is telling me this isn't OCD at least like 3 times a week.
Yeah,
So
totally.
hear it all the time. It's a tricky little monster that sneaks in and tries to get you to pay attention to it, but try not to get fooled by its lies in those moments.
Totally. Yeah, yeah. And kind of accept that possibility, like what if this isn't actually OCD, is another way that OCD sneaks into your mind, right? It's another way that OCD presents itself. So it's just another thing to sit with, right? All right. So let's see.
Really good questions so far.
Yeah, definitely. All right. This is from Boyce Hartzell. Cool picture. It says, hello, any tips for depersonalization and hyper awareness to reality? I've been scared after I researched that some people with severe mental illness start with depersonalization. Although mine is OCD related, I still worry. Yeah, I don't know. Do you want to try to answer this one first, Meghin?
Yeah, kind of piggybacking off of what we were just talking about, right? Is that like that fear when it creeps in, and what's the opportunity that we have there to face it instead of run from it or try to figure it out in that moment. So same thing, regardless of, and actually Jenna and I used this analogy in the past, but now it's appropriate because Halloween just passed yesterday. So Jenna had said on one of our lives in the past that OCD is like going to a haunted house, and every room is filled with these different characters. So picture those characters as your subtypes. Regardless, at the end of the day, the OCD's motivation is to scare you. So maybe one person would step into one room and they're not going to react, but maybe the next room is really, really terrifying. It doesn't matter. Even though it feels like it matters and it feels very isolating, the OCD underneath the surface is getting you to doubt your experience and getting you to give in to paying attention to it and trying to fix it in those moments.
Right. Yeah, and especially, like, to kind of, focus a little bit more on the hyper awareness aspect of things, when you feel scared that you're not actually in reality, for people who are afraid that they're depersonalized or derealized in some sort of way, um, that's kind of what your mind will go to. You become more hypervigilant because it's important to you. And you've sort of sent that signal to your brain, hey, this is something I need to pay attention to. So any little thing that I feel like might suggest that I'm depersonalized or might suggest that I'm not in reality, that's going to set off alarm bells where because you're kind of misattributing danger to things that are inherently neutral because you're so hypervigilant. It's sort of like, think when like we were hunter gatherers, thousands and thousands and thousands of years ago, the people who are hyper vigilant, that was a good thing, right? Like if they were afraid of wild animals attacking, anything that moved funny was a wild animal. Except that now in the 21st century, it's not really that helpful anymore, to have that hypervigilance. So, and that's true for all subtypes, right? If you are afraid of something being true or something happening, you're more hypervigilant to things that might suggest that that might happen. Um, and so again, right, for hyper awareness, continue to say, accept that you don't actually know, right? At the end of the day, um, which is scary, right? Not knowing is though is not the same thing as it actually being true, right? And so, just again, it all kind of comes down to that acceptance of what OCD is throwing at you. So, okay, let's see. Um, okay. How about we do anime fan?
Ooh, another good profile pic.
Okay.
I can read this one out if you want.
Sure.
So when I walk past something and don't touch it, I get really anxious and my thoughts start acting up. What kind of OCD is that, and how do I treat it?
Okay. I mean, it's hard to tell exactly, like just from this. A lot of, if you think about OCD, right, just even what constitutes an obsession, it could be any sort of thought, image, urge, doubt, feeling that feels persistent and recurrent and unwanted, right? So, walking past something and feeling that urge, that intense urge to touch it. In order to do away with anxiety, right? I'm not sure exactly. I would need to know more, but you know, OCD is OCD. It's like it's all treated with exposure and response prevention. Um, so I don't know if you have anything to add to that.
Yeah, I was gonna say kind of hard to
Okay.
categorize.
Yeah.
We would need to get some more background info, but again, I think leaning into the uncertainty of like what is the subtype right now? Like that's a great way for us to practice like not trying to figure these things out. So,
Right,
great
right,
question though.
right. Okay. All right, and this one is from Camille. So hello there. Can OCD cause good feelings to the thoughts? Like not always scary or paralyzing. Sometimes the thoughts and feelings almost feel intoxicating and accurate, and that's the scary thing. Um, I mean, again, right? Like I'm not sure. I mean, I think like if there's a level of distress, it sounds like the distress is coming from like the questioning of like, do I actually like these feelings? Am I getting something out of this? Um, I mean, again, it kind of sounds like that sense of doubt about, is this even OCD? Is this something that I actually want? Um, but I don't know if you have another thing to add to that.
No, I was actually thinking the same thing because that last line there,
Mhm.
that's the scary thing. So the analysis of how you're feeling in response to those thoughts
Yeah.
sounds like that's the level of distress that you're experiencing, Camille. So I would practice some of that like unknown uncertainty around even that idea that those thoughts can be scary and allow yourself to experience that little level of fear that you might be experiencing or a big level of fear.
Right. I always say, a lot of times, our anxiety spikes when we judge or try to analyze our feelings and thoughts, as opposed to kind of mindfully noticing them, um, and accepting them non-judgmentally. So, that could also be exacerbating any of the distress that you are feeling about these, these feelings. Okay, let's see. We're just making our way through. Okay. All right.
I,
So
I apologize if I pronounce this wrong. Sitlali Hernandez. How do you accept OCD, especially with harm OCD that is just OCD and nothing more? Also, is it normal to be in therapy but still feel stuck in the same place? So how do you accept OCD, especially with harm OCD that is just OCD and nothing more? So acceptance, and Caryn, you can kind of jump in here because we might have different thoughts on this, but acceptance is a hard thing to teach. I feel like it's something that kind of just comes with the process of taking the risk of seeing what happens. And the more that you do that, the more confident you end up feeling. And I think that's when the acceptance starts to come in. There's no timeline for that. Some people that I work with have acceptance earlier on in treatment than later. But I think the more that you take the risks in the face of these fears and just see what happens by trying not to do anything about them, the sooner your acceptance is going to come along the line. But yeah, I think it's normal to be in therapy and feel stuck sometimes. And a big component of that is sometimes, and not to say that this is the case, but sometimes we do have some roadblocks put up for ourselves if we're not leaning into that acceptance of our experiences. But Caryn, your thoughts?
sure. Yeah, I mean, it's hard, especially for subtypes. Like we always say, like subtype doesn't matter in terms of treatment, like how we would treat it. It can certainly matter to the people experiencing it. And so I always like to just throw that out there. I think for people with harm OCD or kind of like the taboo type of violent thoughts, it can feel really just repulsive to that you have these. It can feel really dangerous that you have these, or kind of incredibly difficult to accept that you have them. And it can feel really risky not to take them seriously. And so again, right, a lot of time, like a lot of what ERP is about is changing your relationship with anxiety, changing your relationship with the OCD, so that behaviorally, right, the more we do exposures and response prevention, you have the opportunity to learn a new way of responding to these triggers. A new way of responding and dealing with that, like those internal phenomena that is OCD. And so yeah, kind of similar to what Meghin was saying, right? It's sort of something that kind of acceptance can be learned, right? But I also think that like sometimes acceptance can really come in the form of willingness, the whole like idea of like I want what I don't actually want, right? This is terrible and this feels wrong, and I actually want to feel this way because I want to get better, right? Um, or, because I want to spend more time with my loved ones, or I want to be able to do the things that I care about again. And so I think recognizing that risk is actually inherently neutral, and oftentimes kind of like what I was saying earlier, um, things will feel more risky because for people with anxiety, they attribute danger to things that aren't actually dangerous. They attribute safety to things that have nothing to do with their well-being. And so again, like acknowledging when you're trying to practice response prevention, okay, everything within me is telling me to go check, or everything within me is telling me that this is too dangerous, or that I don't care enough, and that's why I need to do these rituals to prove that I care enough. And I know that that's actually not true, right? It's another lie that OCD has fed me, and I don't actually need to, take OCD up on that offer to live a good life. And so it's a process, right? And I think if you're feeling stuck, I think that's also a good opportunity to collaborate with your therapist if you are working with one. See if there's something more that you could be doing, something that you could be doing differently, incorporating different types of exposures, or fine tuning that response prevention in some way. And like, seeing if there's any sort of roadblocks. So it's always it's always an opportunity to kind of examine things.
Yeah, I think that's a good thing, just to keep in mind for everybody too. Like your therapist is your teammate and your partner in this. So If you are feeling stuck, I always encourage you to voice that, because we want to hear those things. We want to know how you're feeling. And sometimes that can make us feel uncomfortable voicing how
Yeah,
we're feeling and what our experience is. So, again, view that as another opportunity to kind of just be uncomfortable and have that conversation and see what can take place.
totally. Yeah. Um, Good question though.
Yeah. I don't remember if I read the last one or not. So,
That's it. I'll do it. It's fine. All right. So just turned 30. Okay. Happy birthday, Brittany.
happy
All right.
birthday.
My OCD is attaching to it. You are getting old. Death could be near. People you know have died in their 30s. The core fear of being separated from my son, dying, etc. Oh, this is a two-parter. Okay. So the second part. So I have self-harm OCD, somatic OCD, and fear of dying in general, and depression OCD. Any advice? So yeah. So I mean, death is scary, right? I don't think that I think that's a pretty obvious statement. It's understandable to be afraid of being away from being like separated from your loved ones. It's normal to be afraid of that. And of course, right, because you are so afraid of it, like it's not surprising that your OCD has latched onto what if I harm myself? What if I am depressed and then harm myself, right? Um, I think for this kind of stuff, in terms of advice, I think recognizing that OCD can sometimes take us away from the thing that we care about the most by doing your compulsions. And so really identifying, okay, in what way have these compulsions taken me away from time with my son or time from doing things that I actually care about in my life? How can I have more of that, right, instead of my compulsions? Um, and then again, right, to kind of go back to acceptance of like, yes, like death is a part of life. It's like the only guarantee that we have, right? Death and taxes, right? As that famous statement.
Unfortunately.
Death and taxes are the only certainties in life, right? And so it's about like before you started having these fears, was it something that you tacitly accepted, right? Like you kind of took it for granted, right? That one day it happens. You kind of knew that from a young age, I'm sure, right? Once people are aware of that, it happens to people. But it wasn't really until OCD said, pay attention to this, that it became really important. And so again, it's kind of recognizing, all right, I didn't care about this all that much until OCD latched onto it. And so I need to act as if I care about it in the way I used to care about it, which is, not that much, right? Um, yeah, I don't know if you have any nuggets of wisdom to add to that.
I think exactly what you're already touching on, which is like the practice of living to our values, right? Is it
Mhm.
worthwhile to be spending time in these compulsions and being taken away from the precious moments that we do have, and focusing on the inevitability of something that is also very unknown? Like, none of us know what that looks like until we get there, but we're all
Right,
going to experience it at some point. And that comes with a lot of experiences in life in and of itself. And that is the driver of anxiety and OCD,
right,
is
right,
trying to
right.
get us to focus on the things that we really can't control. I really liked what you said earlier in one of the previous questions, was like the perception of the safety behaviors too,
Mhm.
because we always think about the fears, but I don't think we think about like the disillusion of engaging in safety behaviors when they're not actually creating any safety either.
Right,
So,
yeah,
do we want to sit and ruminate about something that we can't fix or control and we can't predict, and be taken away from the life that we have in the moments that we have it?
totally. Yeah. And then I think in terms of advice, right? And this is helpful for anybody tuning in, but when it comes to exposures, and when it comes to ERP, in a nutshell, right? It's kind of doing the things that scare you, that OCD is saying that you must avoid or can't interact with, purposely approaching those in whatever way you can, and then doing the opposite in whatever way you can of what OCD is telling you you have to do. Um, so approach and do the opposite, right? ERP in a nutshell. Right?
Yeah.
Obviously, it's like more complicated than that, but if you're ever confused on like, actually, this leads me to the next question really well. If you're ever confused about like what to do for an exposure or if what you're doing is a compulsion, you can ask yourself, is this taking me, am I trying to get rid of distress or am I trying to learn to live with it? Um, yeah, it all comes down to function at the end of the day, right? Why are you doing that? Anything could be a compulsion, including exposure, if you're doing it with the sole purpose of getting rid of uncertainty, getting rid of distress. Um,
Yep.
yeah.
Does this make me feel more comfortable right now?
Yeah.
The answer is yes, or even leaning into yes, then we know we're probably doing a compulsion.
Yeah. Yeah. Um, and you find that a lot also for people who are perfectionistic about treatment, or kind of like that, like EB's question earlier about doing, flooding for 45 minutes right
Right.
off the bat with like really, really high level exposures, right? Um, Probably not in the spirit of ERP, even though it looked like ERP. Which is not to say that it's EB's fault or anything like that, but more so like it's totally understandable to want to get rid of this terrible thing. But the best way to get rid of it, or the best way to get through it, is to experience it, right? So, yeah. Okay. Let's see. I guess we can ask this question. I'm not sure if I have an answer for this one actually, so maybe Meghin does though.
I'll read it out. At least I can read it. Myra Garcia says, is it possible in OCD to have thoughts with anxiety, but not uncertainty? I have not seen this question yet. Is it, I mean, I guess anything's possible. We
Right,
want
right.
to kind of practice what we preach here and not give a direct answer. But yeah, I don't know if I have an answer to that.
Yeah, I mean, I would imagine, I know some people have a fear, like in the case of like, what some people call like Tourettic OCD or just right OCD.
Mhm.
It's not like there's a like a feared consequence that they can point to easily, but it might be more like the uncertainty of never getting rid of that feeling, or maybe there's a fear that um yeah, something bad might have happened in the past, or something bad I mean, yeah, I'm not really sure, but I think when it comes to anxiety, if you break it down, it's always about like the fear
Control.
of what if,
Yeah.
or um yeah. So sorry, Myra, we couldn't be of more help. But I'm gonna lean towards no, right? There's probably something that is a question mark in your head. And if there's a question mark, that probably points to some level of uncertainty. Um okay. So all right, this is a good one. Okay, so it's from Emma. I am having relationship issues. And so, how do I make sure that it is real issues and not my OCD?
Another common thing that I think we hear.
Mhm.
So we don't have to always figure these things out. I think we put a lot of pressure on ourselves to find the answers to the like, how do I know if it is this or not this? I would
Mhm.
err on the side of caution. And I would, again, try not to answer those questions when they immediately pop up. I would practice just leaning into the discomfort of what that might mean if it were real issues and not your OCD, and give yourself permission to not find the answers to those things urgently in those moments. That's a
Mhm.
really great practice and habit to build when you do have OCD, regardless of how the symptoms are presenting. And
Mhm.
again, it's hard to not give a direct answer on that because it would feel really great to say, well, if you are having real relationship issues, like you want to get to the bottom of it and solve it and make sure that you fix it in those moments. But I would err on the side of caution and take the pressure off yourself to not figure it out and
Right.
put the pressure on to just lean into the discomfort of not knowing.
Right. Yeah. I mean, oftentimes with our OCD, relationship OCD, there is also like that sense of urgency. And so if you are having that sense of urgency, meaning like I need to know this, I need to figure this out now, probably a sign to try to, again, not to sound like a broken record, but to kind of sit with that Sit with that uncertainty about not knowing what the outcome of your relationship will be, or not knowing if not having the answer to whatever question is sort of going through your mind all the time. Okay, so let's see. Next question from Marissa Marks. All right, what's the difference between going to a normal therapist versus one trained in OCD?
It's a good question. I think this is an important topic also to
Mhm.
discuss. I love my metaphors and analogies. For anybody that knows me,
Yes.
knows that I use them all the time. But I like to think of it of, if you are to go to a heart doctor for a brain issue or a foot doctor for a lung issue, you want to make sure that you're going to somebody that is well versed and trained in the thing that you need treated. A lot of times there's anxiety treatment for general anxiety, but for somebody who's not trained in understanding how OCD operates, there can be feedback and suggestions and therapeutic interventions that are offered that are actually very counterproductive to being helpful when it comes to OCD. A lot of times the go-to is like teaching coping strategies to calm the anxiety. But we know with ERP and in OCD treatment, we want to do the opposite. We want to be able to learn how to tolerate the distress, to face it head on. Because when we get caught in those OCD loops, the more compulsions we do to calm that anxiety, the more it's actually reinforcing and bringing our symptoms back. So even though a talk therapist or another type of specialist would mean well, a lot of times if they're not trained in OCD, they're not going to give the best feedback that you're going to need as the individual living with OCD.
Yeah, very much so. I love metaphors too.
I
But
always love hearing new
oh
metaphors. So
yeah. This is the one I always give. So, and this is particularly true if you see a therapist who does CBT, for example. So it's sort of like ERP therapists. Like ERP is a form of cognitive behavioral therapy, but not all CBT therapists are ERP therapists. So it's sort of like how squares are rectangles, but not all rectangles are squares. You want to go to the squares, not just any rectangle, right? And that's really the difference, right? It's just like a different focus rather than focusing solely on coping skills or solely on challenging the cognitions. It's behavior first for ERP. Okay.
Okay, Matthew Smith Undercover. I've OCD for 4 years now. My family and friends joking about my condition. I always clean my shoes before I wear them, even if it's been 5 minutes of taking them off. Any advice on getting nice back shots? Like getting back at them? That's how I'm interpreting that, but I'm not sure.
Right. Yeah. I actually not exactly sure. I'm assuming like you want like some support on like how to respond to this, respond to your family and friends, kind of making light of what you're dealing with. I mean, I think education is key. You can always send them, to the International OCD Foundation website. There's like articles on like what family members should know. I know NOCD has some information, some videos and articles. If you feel comfortable. I think it could also just be something as simple as like, hey, like this is really serious. It's really affecting me, and like I'm not laughing, right? And some people just don't know how to deal with people's distress, right? They just don't know how to deal with it. And so sometimes you kind of have to say like, okay, if you really like, okay, like if you want to help me with this, like here's what you can do instead of trying to like make light of it. Yeah,
Yeah,
just kind of being vulnerable, like, hey, like that kind of stings. Like that's not actually very helpful. So
it's good advice. And I'm sorry, Matthew, that you're experiencing
yeah.
that, because it never feels good to be teased for anything, but especially when we are internally struggling with a mental health condition that already feels very isolating.
Mhm.
It doesn't help when the people that we care about and the people that we want as our support system kind of breaks us down a little bit. So great advice, Caryn. I think just communicating like this is something that's serious and it's a really debilitating condition. And I'd really love to be able to provide you some information on what that kind of is like and what it might feel like for me. So that way you guys better understand. If they're open to that, great. And there's plenty of resources out there, even through NOCD and our Instagram page and our YouTube channel and IOCDF, like you had said, Caryn. So hopefully they're open and willing. But yeah, sorry, Matthew. That's not fun.
Yeah. And also, I guess, like, especially, sometimes we can't control how other people respond or how other people treat us, but maybe connecting with people that do understand, right? Whether it's peer support or going to some sort of support group of some sort, that can be really edifying in that way too.
Yep.
Um, okay, let's see. This is from Smileaways 759. So I've been feeling low, and that makes me lose the ability to love, with my themes of sexual orientation OCD and relationship OCD. It triggers me when I can't feel love for my fiance. Is it normal to feel sad and lose the ability to love during ERP? Yeah, I don't know if Meghin, you want to take try
Yeah.
answer.
So I don't want to answer the is it normal per se.
Mhm.
I would say that I don't know if we necessarily have the answer to that other than ERP is really, really difficult. And for any individual experiencing or going through ERP treatment for OCD, it can cause an array of different types of emotions depending on you as the person and your experiences. So I would say don't analyze the fact that you are feeling that sensation. I would say practice kind of leaning into it. Again, I know this is kind of sounding a little bit repetitive, but also not wanting to invalidate that experience either because again, like you said before, I don't want to prioritize how one subtype is maybe sometimes more challenging than others, but when it comes to the sexual orientation OCD and the ROCD,
Mhm.
it can feel very rooted in reality and very confusing sometimes because we are in these relationships and then we start to question our experiences with that person. So, yeah, it's challenging. Try not to figure that out in those moments. Do your best in those moments to allow yourself to be with the exposure, allow yourself to not self analyze what those feelings may or may not mean or what they may or
Mhm.
may not be. But that would be my feedback, Karen.
Yeah, yeah. And again, right, I love like talking about kind of the way like that our anxiety can make us biased, right? And so I would ask yourself if there's some sort of evaluation of your feelings in that moment. Do I love him enough? Do I love my fiance the right way? Do I care enough? Because it's sort of like if I were to tell you, like, are you watching a live stream right now? Right. And then I kept asking that, you would be like, am I? Right. Even though, like, you are. Right. And so the more you kind of question something, the more unsure you get. It's really like that catch 22. Um, and that's why, compulsions don't work because they continue to send that signal to the brain that there's something wrong. And so again, right, I would really examine, am I judging my feelings? Am I trying to analyze them? Am I trying to compare them to some sort of perfect ideal that doesn't exist? Um, but yeah, that's how I would go through that. Um, okay. So all right.
So Jenny B says, my OCD makes me feel guilty about intrusive thoughts. The guilt and shame are exhausting. How do I become strong enough to believe in myself and not rely on my boyfriend for reassurance?
Mhm.
Great question. First word that pops in my head is support, but I want to let you answer.
Sure. Yeah,
Um,
yeah.
so go ahead, Caryn.
Right, right. Yeah, there's a lot in here that we can unpack. So I want to talk first about that guilt and shame. Um, I think it's helpful in those moments to recognize that OCD is throwing those things at you and making you feel like you have to care or making you feel like that's you. And so really practicing some good kind of cognitive diffusion from that. So like right now, if like this is you and this is your OCD. They're kind of like this. And you're kind of like, yes, this is me. Like I am my thoughts. I am this awful person. And now because I feel like this awful person, because I don't actually want to be an awful person, now let me go and do all these things to prove that I'm not. And let me take these things seriously because like I don't want to be this terrible person. And so I think it could be helpful to just be like, okay, actually, these are these thoughts and these feelings, this guilt, this shame is what OCD is throwing at me. It's like the passenger on the bus, and I'm in charge of this bus. I'm going to drive this bus, right? To use this extended metaphor. And guilt and shame are just those like hecklers in the back of the bus who are criticizing me this whole time. And I can either choose to listen to them, and that could drive me away from what I actually want, or I can choose to just let them be there to the point where like I can start to learn how to ignore them and I can continue to move towards what I actually want. Um, Not just what I want, but like what is good for me, what is in line with the kind of person I actually want to be. Um, the guilt and the shame, you don't have to own it, even especially because remember to go back to what I said earlier about doing the opposite. OCD is saying, own this guilt, own this shame. You're a terrible person. How dare you try to take care of yourself? How dare you think that you don't need to do these compulsions? That's proof that you're a bad person, all that terrible stuff. So what's the opposite of that? To say, okay, OCD, thank you for telling me, right? I'm going to choose in this moment to show myself compassion and to take care of myself and to recognize that my brain sometimes is wrong. My perceptions are sometimes wrong. And I don't need to actually believe everything that my brain tells me. Right. Yeah. I don't know if you have anything about that
It's like
part.
putting
Yeah.
space between you and the OCD, right? Becoming more of an observer of your experiences rather than a victim of them. So
Right.
the more that you can separate in those moments and be able to say, I see you, I hear you, and I also don't have to agree with you, and I can go ahead and move forward with my day or my moment the way that I would choose to, as if you weren't here right now. And what would that look like for you, rather than dropping everything, paying attention to it, kind of fueling the fire a little bit by saying, yeah, should I feel this way? Do I feel this way? Does this mean something about who I am as a person? Being able to give yourself permission again to just not be responsible for the experience that you're having. It's
Yeah.
there, you see it, you notice it, you can observe it, and you don't have to act on it.
Totally. Totally.
And the other thing I was going to say was support before, because that's the first thing that popped in my head of how do I become strong enough to believe in myself and not rely on my boyfriend for reassurance. So I think really good support, really good treatment can help with that big time. And like I said earlier, having that teammate, your therapist, who can help walk you through that and help just be the person that's going to support you through that process and give you the right skills to utilize in those moments is really, really beneficial.
Definitely. Yeah, and I think also like the feeling of strong enough, it again, right? It's not like a sudden thing where suddenly
Right.
you're gonna be like, okay, I got this.
Right.
It's really a daily practice where like suddenly you're like, oh, that doesn't bother me the way it used to, or like, oh, I don't remember the last time I did a compulsion. You won't realize it but it's like you get there with like small steps, right? So treating yourself with compassion is not like a one-time thing that will last forever. Showing up for yourself, believing in yourself is not just like a thing where you wake up and you're like, I'm going to believe in myself forever, right? It's a practice, right? And so keep going with it every chance you have in whatever way you can today. Yeah. All right. So let's see. I'm looking through here. So, okay, let's do this one. So this one is from David Thomas. So it sounds like maybe the daughter is the person with OCD. So is it common for people with OCD to not be thoughtful towards other people? I have trouble with my daughter not seeing things from anyone's perspective except her own. Yeah, I don't know. I mean, that can be tricky, especially for families, loved ones of people with OCD. OCD it can take up a lot of like people's mental energies. It's like they're faced with the thing that they're afraid of most, constantly throughout their day. So it can be really hard to focus on other things or to kind of step outside of that perspective. Um, if you are, a family member or a loved one of anybody with OCD, there is like support out there. There is information out there on how to best support somebody. Definitely setting those boundaries in terms of family accommodation can be really helpful, not just for the loved one with OCD, but also for your own kind of family dynamic and relationship with them. Um, but yeah, I don't know if you wanted to add anything to that.
Yeah, I think a lot of times too, when it comes to OCD, the compulsions are not just outward and physical. That a lot of times there's a lot of stuff going on in the brain and in the head, and like you said, you kind of spend a lot of time there where it may be perceived as a lack of thoughtfulness, but the individual may just really be so engaged with what's going on in their mind that they're not able to be thoughtful in those
Mhm.
moments. And it is a really isolating experience. So I think, like you said, Caryn, just the education for family members, being able to understand a little bit more about the experience for your daughter, and then being able to offer up support that could be helpful to bring her back mindfully to the present moment, and skills that she can learn for herself to do so too. But really tough
Mhm.
for the families.
Right, right, totally. Um, okay, so let's see. So I'm
Okay.
new from Chrissy, Elena. I'm new to the movement. I had my first call to get started today. Well, that's
Woo!
fantastic, right?
Welcome,
Um,
Chrissy.
that's really awesome to hear. I mean, I think that's sometimes that first call is really the hardest step for people. Not to sound like cheesy, but I feel like all
It's
therapists
true
say that, but
though.
it really
It's
is
so
true.
true.
We say it a lot because it's true, right? And so I'm really hopeful and excited, and I wish you all the best with that.
Yeah,
So
me too. Good luck.
yeah. Okay. Han Solo.
He
Do you want to read
said,
this one?
or Han says, I recently started to think about something I may have done as a child. I've gone over the everything, and this memory doesn't seem real. I highly doubt it happened, but why does my mind say that it did? This is alluding back to that false memory
Mhm.
question earlier, right? Well, first of all, let's put it into context, right? We can't control the past, we can't control the future. All that we can do is be present in the moment and reconnect to what's going on in the here and now. So when we get caught up in analyzing things that have happened in the past, gets to be a really slippery slope and a really easy slope to get caught up in mental compulsions where you're mentally reviewing situations, you're mentally checking maybe something that you did or didn't do, reviewing conversations you had with people, reviewing relationships, reviewing all these things where you can literally go down that rabbit hole for hours and not be in the life that you wish to live in the days that you're living it. So
Mhm.
we might not be able to figure out exactly what that memory was or what it meant or if it was real or wasn't real. Is it worthwhile investigating that? Or is it more worthwhile allowing those thoughts to be there and not trying to fix them and urgently respond to them in those moments?
Yeah, for sure. And yeah, I feel like you said it all, right? So, um, all right, let's see. Um, so this Rainbow Six Siege random clips. Basically, they said if I have thoughts all day and I just don't engage with them and let them be there and go through my day, even with anxiety, through time it will get better and it will slow down. It sounds like it shouldn't work, right? Especially like it sounds really bizarre, right? Like, how does that work? But it's it's wild stuff, right? It really doesn't sound like it should work, but if you think about it, like compulsions don't work either, right? And constantly needing external things or mental processes or behaviors to try to, compulsive behaviors to try to make yourself feel better. That's not, that's not helpful either. And so recognizing if you have the thoughts all day and you practice kind of letting them go, um, it will get better. I like to compare, this is a metaphor that I like to use sometimes when it comes to intrusive thoughts and kind of letting them be there, and the whole idea that they will decrease over time. And so imagining that, like, if somebody with OCD, if your mind is like a room full of like really like a lot of telephones and they're all ringing, and how do you get rid of the ringing? You pick up the phone, right? And what happens when you pick up the phone? There's a person on the other end being like, "Hey," and then you get sucked into these conversations all day. And then you feel even more anxious because, like, as soon as you hang up, and then another phone starts ringing, and then another phone starts ringing, and then you just feel like like trapped, right? But then if you stop trying to answer the phone, what do you think will happen, right? Eventually the ringing stops. And, this is like such an extended metaphor, but like people will be like, oh, that number, nobody ever answers it. So don't even bother calling it, right? They never pick up, don't even bother, right? And then eventually sometimes the phone still rings. Sometimes it rings less for shorter amounts of time. And sometimes you just forget that it's there because it starts to become background noise. And that's really, the whole idea of kind of creating a new pattern, creating a new relationship, habituating to the thoughts themselves, right? Yeah. But I don't know if you have anything to add to that.
Yeah, don't wait to believe before you take the risk, because sometimes we
I
sit
love
on
that.
that. Yeah, sometimes we
Yeah.
sit on that and really we can keep waiting for a long time because we may never get there. So I would say take the chance and see what happens, and
Yeah,
then you can
yeah, I
believe
love that.
after the fact.
Right, right. It's like you never know till you try it, right?
Yeah.
Um, okay. Let's hear from Veronica.
Veronica Fernandez. Okay. How to handle ROCD when you have been with the person for over 4 years and this just comes out of nowhere. Any way to deal with this head on?
Mhm.
Well, jumping in head on sounds like something you're ready to do. So I would encourage you to, again, I sound like a broken record, especially with the ROCD stuff, but don't make decisions around your relationship when you're feeling urgently inclined to do so. The ROCD is going to get you to doubt your relationship. Is this the right person? Is this the wrong person? Should I stay with this person? Am I attracted to this person? Does this person love me? Do I love them? What if, what if, what if? Regardless of the form that it comes in, you don't have to figure that out in those moments. If we think about
Mhm.
any relationship, we can't predict the future with it. I don't know if I'm going to be with the person that I'm with a month from now, a year from now, 10 years from now, whatever the case may be. But if I spend all my time trying to figure out if that person is the right or the wrong person for me, I'm missing the opportunity of actually
Mhm.
experiencing the relationship and understanding if that's going to be the person I end up with or not. So it can feel really hard when it hits you out of nowhere, the way that you're explaining. And that surge of anxiety kind of comes in, but try to put that space between you and the anxiety in those moments and just make the commitment to not try to get answers to those questions when you're feeling really distressed.
Yeah, very much so. Um, and I would always say, like, on like a really concrete level, like, see if you're doing any sort of processes or behaviors to try to get rid of the doubts or to figure things out. If you're doing a compulsion, um, I would focus on not doing them as much as possible, whether it's delaying or ruining the ritual in some way, reducing it in some way. You really want to, like, compulsions are the fuel for OCD. It kind of makes it spin larger and larger, and so we want to cut those down as much as possible. All right.
I'm stealing your telephone metaphor, by the way.
Oh yeah, I love that
I
one.
really like that one.
I don't know, like, how. Yeah, I don't know how I came up with it, but it's a good one. Um, all right, this is from Tony. So, is it common in sexual orientation OCD to try to prove that the thoughts you fear are true?
Mm.
They followed up with this question actually. So, are there compulsions done to try to prove the thoughts you fear are indeed true instead of false? Yeah. Oftentimes, like, and that's why sometimes if people are like, if they veer too much into saying like, yes, I am, yes, I am gay, or yes, I am straight, or whatever it is, or yes, I am, a bad person, or yes, I am going to die and get sick, right? It's sometimes, again, right, the function of that can be to try to like eliminate any sort of doubt, or uncertainty, because for some people, uncertainty is way harder to deal with than just like bad things coming true, right? And so again, right, like sometimes if you notice yourself leaning towards either extreme, find that gray middle, that middle area where it's like, oh, I don't really know, right?
Yeah,
Maybe,
the proving,
yeah,
that word is sticking out for me
proving.
too, right? Is
Yeah,
trying to get a really definitive answer around something. We
totally.
want to try to do the opposite of that. We want to try to
Mhm,
not get an answer to that. We want to just allow that thought to be there and that really uncomfortable feeling to be there around it, and not try to
mhm.
prove anything to the OCD in those moments, because that's exactly what it wants you to do. It's
Totally.
selling you either an exaggeration or a lie so that way you can follow it up with paying attention to it and trying to prove it in either direction. Um,
Mhm.
in my opinion, not worthwhile.
Right, right, right. Um, okay. So, is there a sliding scale for me because I only have Medicaid? Asks Cup of Noodles. Um, and as of now, I mean, I'm not exactly sure like what like the official thing is, but you can always contact, like if you're talking about NOCD, you can always contact them and then talk to billing. Um, but yeah, I mean, as of now, there are some like lower cost options if it's not through NOCD. Depending on where you're located, and also um like if you're close to like a university, sometimes they have like people that can work with you, postdoc students, who are directly supervised by clinicians, or some people do like like a certain level of sliding scale or even pro bono. So you can look around on like the International OCD Foundation. You can also call NoCD to see if they would be able to help you out with that in some form or fashion. But I definitely think being able to access care is super important. So hopefully you're able to kind of to find that in some way. Um, all right, let's see. This is from Andrea Salazar. Um,
I can take this one from
yeah,
you. That
sure.
way you're not over reading. I'll give
Yeah,
you a little
yeah, you're fine.
So Andrea says, been doing therapy, ERP, OCD, depression, and tons of stressors keep hitting me left and right. Made some progress, but feeling like I need time to figure out life again, but stuck and don't know how. So it sounds like you've been doing therapy for OCD and depression. I hope I'm interpreting that correctly.
Mhm,
Um, and now you've got a ton of life stressors kind of coming in and making it really difficult, and making things
mhm,
feeling even more overwhelming. So some progress, which we want to make sure that we give ourselves credit for, by the way, because some progress is really significant. But feeling like you need time to figure out life again because you're stuck and you don't know how. Um, I'd want to ask if you're currently working with somebody or not, because again, I would redirect you back to having that conversation with your therapist if you are currently still engaged in treatment, because
mhm,
they're the best resource then if you are currently working with them to help you figure out how you're stuck, why you're stuck, and what can be done to help you move forward and get past that hump. But
mhm. Yeah, yeah, definitely collaborating. Kind of similar to that other what we were talking about earlier. Like if you're coming across roadblocks, trying to figure out what those are, and working with your therapist. Um, all right. So this is from Pauline McClellan. Is it ever too late to seek treatment? I am in my 50s and have had OCD. I'm guessing that meant to say since childhood. It has ebbed and flowed in severity, but it's pretty bad at the moment. So thanks from the UK. No, it's not too late. I mean, I think like if, I think as whatever like however old you are doesn't matter, right? Because it's about right now, moment to moment. And so I think if right now it's pretty bad, it's not too late to start treatment. You know, I saw this thing about like 10 years from now, you'll wish you started today,
Yep.
right?
That is so
Um,
true.
yeah, and so I think that that's true for most anything, right?
Yeah.
So why not for this too? So I hope you can reach out and get the help that you need, Pauline.
Yeah.
Um, all right, let's see. I know we only have like a minute. We started like a minute or two late. If you can hang
We
out,
can squeeze in
we can squeeze in
another
some
2
more.
or 3. Yeah, whatever.
Um, okay, let's see. How do you how do you deal? This is from Pablo Casado. So how do you deal with feeling horrible when you're not even having intrusive thoughts? Um, well, I'm sorry if you're feeling like that, Pablo. Sounds tough to be struggling in that sense. But I mean, I would kind of try to examine like, are you um, kind of avoiding doing certain things that you typically would enjoy doing? Are you doing any sort of sneaky safety behaviors as
Mm.
well? Um, yeah, I don't know if you have any other
The sneaky
feedback.
safety behaviors,
Yeah,
they kill me. Yeah, they can be very subtle, so I would kind of give some thought if you're doing anything to kind of calm down the anxiety in the moments when you are feeling distressed, because that's a good place to start with, then practicing resisting some of that, and
mhm.
re-engaging with the things that you care about in your life, and
Right, right,
things that
right.
are valuable to you, the things that you would be doing um, if things were happy and rainbows and wonderful when you
Yeah,
wake up. So what
yeah.
would that day look like, and taking that day by day. But I'm sorry as well, Pablo.
Yeah, yeah. And I think also, if you do have a therapist, if you are working with somebody, to continue to talk to them, right? So that they can see if there's, maybe some underlying depression going on,
Yeah.
things like that. Because obviously, like your well being you're not just OCD, right? You can also be dealing with other things. And so it's important to address all that as well. Um, so let's see. I wanted to just like do this question real quick. Um, because I think it kind of points to some like the kind of like the transdiagnostic
Mm.
approach, right? So addressing OCD in terms of body focused repetitive behaviors and BDD. Obsessive haircutting has been an ongoing problem. Hours spent trying to achieve symmetry, only to end up with um, my scalp, I guess, appearing. Um, I think regardless of kind of like what like the diagnosis is, whether it's a BFRB or if it's rooted in BDD, really working with a therapist to help understand like that functional relationship between the behavior and the trigger and the feared consequence, um, to kind of address it at its root, I think can be helpful. Um,
Yeah, and finding the right
yeah.
specialist again, right? Because we don't wanna be treating something, in the wrong approach. So that
Right, right,
that
right.
functional assessment is so important in
Right,
understanding what's driving those behaviors.
right. Yeah, because if it's like trichotillomania, for example, that's gonna be treated slightly differently than if it's, OCD, which is gonna be treated slightly differently than if it's BDD. And so really if it is BDD, and you're trying to achieve a certain appearance, or if it's OCD and you're really just focused on, creating that kind of internal sense of symmetry, right? Kind of working with a professional there. Um all right. So maybe can we just take one more?
Yeah.
Okay.
All of these have been
These are
amazing.
really great. I wish we could take all of them.
I know.
But yeah, so this is a final one, just in case other people are also wondering.
Great closing
Um,
question.
yeah, yeah. This is from Kaylee. So how do I get started with no CD treatments, such as how does the treatment process work, with getting matched with a therapist, etc. Um, I don't know. Do you want me to take this one or yeah, okay.
Yeah.
So
Close
essentially,
us
right,
out.
go to treatmyocd.com, and you can talk to a member of our care team, and they will see, where your location is. And then, if you have a specific therapist in mind or specific, or if you just want to get started right away, they'll kind of find whoever has that opening, or whoever is able to work with you at that moment, and get you started. If you do have a therapist in mind, you can also like directly request that person as well, depending on if they have availability. You might have to wait then. But it's pretty easy. They're really supportive. They get back to people as quickly as they can. So yeah, it's just a brief call just to kind of so they can get a sense of what you're dealing with. And then after that, once you have your session, the therapist will then work with you to figure out the best treatment option in terms of, figuring out what's actually going on with you and how to best support you. So yeah, it's just a phone call away, I guess. So
Yeah.
yeah. All right. Well, this was fun. I wish we could have answered all the questions. There were a lot of really good ones, but I tried to answer in a way that kind of addressed multiple questions all at once. So, but yeah,
All
if
right.
you,
Awesome.
yeah. So thank you guys. Thank you everybody for joining. And I hope you all have a really lovely evening. And yeah, thanks everybody for joining.
Hopefully we'll see you soon.
All
Bye.
right. Bye-bye.